In this video, we will be discussing about the details of modified stop and chop. This is a very efficient technique. It is different from stop and chop and can be used as a stepping stone for direct chop. It can be done for any grade of cataract from NS2 to 3 and even harder grades. It's quite easy to master. Here I am making a 2.8 by 2 mm self-sealing incision. And my entry is just at the posterior limbus. I am doing a topical phacoemulsification. Make sure that the anterior chamber is well formed with viscoelastic before we start our CCC. I prefer to do my capsular rhexis using a 26 gauge bent cystotome from the main port. You can also do it from the side port. I am aiming for an adequately sized 5 to 5.5 mm rhexis. Rhexis should neither be too small or too big. Following which I am making my side port. It is not very close to the main port, around 2.5 clock hours away from the main port. Before doing the hydrodissection, burp out the visco from the anterior chamber. Use a 27 gauge cannula 2cc syringe. Keep pressing the posterior lip. Go up till the equator of the nucleus, tent up the rhexis margin and then firmly press the fluid. You can see the posterior fluid wave. Tap on the nucleus to release any entrapped fluid and rotate the nucleus fully. Now we will observe the details of the modified stop and chop. In this video I have taken out only those bits where I am doing instrument exchange. However, most of it is unedited video and in real time. In a classical stop and chop, we achieve a long trench or a tunnel in the middle of the nucleus, divide the nucleus into two parts, chop the nuclei and then emulsify each of the heminuclei. However, in modified stop and chop, we achieve a short and a deep trench proximal to the main port. It should be deep enough so that the red glow is visible, and this is in the sculpt mode with power being 50 to 60 for NS3 grade of cataract, vacuum 100, aspiration 24, and then we go to the chop mode and embed the phaco tip into the substance of the nucleus and use the vertical chopper. Here I am using vertical chopper to achieve a good crack. I make sure that I do not move my phaco probe, otherwise occlusion will break. One tip to keep in mind is when we are embedding our phaco tip into the nucleus substance, we should go in foot position 3 and immediately come up to the foot position 2 so that the occlusion is achieved properly. Here you can see that I am doing a multi-level chopping. That is, first I achieve a superficial crack using my chopper and then I go deep into the substance of the nucleus to achieve a full crack. I make sure that the posterior plate is cracked fully by using multi-level chopping. When I am doing chopping, my parameters are vacuum is 500, aspiration is 34, and I prefer to keep torsional power off here and longitudinal on around 50 to 60. However, it is a personal preference. It is a Legion machine. Now I come to the quad mode. In the quad mode, my parameters are almost the same. Vacuum is 500 and aspiration is 34. Here I keep my torsional power on, power being around 60. We can see how easily each of the pieces are emulsified. Here I have chopped the nucleus into 4 pieces. We can chop it into smaller pieces as well. When we are nudging the nucleus piece, we make sure that we use the second hand instrument to nudge the nucleus. If we are using the phaco probe, we have to be very careful so that when we are nudging the nucleus, we are in the foot position 1 and not in 2 or 3 to prevent any damage to the posterior capsule or the rhexis margin. So when we go to the last piece, here you can see that I have emulsified all the pieces, only the last piece is left. We can go to the epinucleus mode, especially useful tip for the beginners. However, it is a dense cataract, so I cautiously proceed with my phacoemulsification in quad mode itself. And I nudge the nucleus in front of the phaco tip, and with the help of the chopper, I chop it into smaller pieces and emulsify. I prefer to do a bimanual irrigation aspiration. So before making my side pots, I adequately form the anterior chamber using viscoelastic and use my blade to make the second side port just opposite to the first side port. I also enlarge my first side port. As for my second hand instrument, I do not prefer to go in fully to prevent any leak initially. So I continue with my bimanual irrigation aspiration. Ideally, the irrigation port should be first put inside into the anterior chamber. However, here I was just clearing the blood from the other port. So the anterior chamber should be well formed with viscoelastic before starting the IA. Now my irrigation port is in the right hand and aspiration in the left hand, and I go beneath the rhexis margin and catch hold of the anterior lip of the cortex and pull it in a circumferential manner towards the center of the anterior chamber. I make sure that I press the foot pedal down fully only when I come to the center, because this is the area which is the safest and the deepest part, and this prevents any inadvertent capturing of the posterior capsule and prevents any PCR. Now I change the hands with the irrigation port in the left hand and the aspiration in the right hand. This helps to take out any subincisional cortex. Look how easily the whole cortical aspiration is done, and I polish the posterior capsule. I prefer to do a hydroimplantation for most of my IOLs. I find it to be quite safe and easy technique in my hands. You can see the leading haptic goes into the bag, and I use the other hand instrument, my aspiration port, to gently nudge the trailing haptic into the bag. However, some IOLs have a tendency to unfold quite slowly or to shoot out of the injector. In such cases, we have to be quite careful. We can also opt for a viscoimplantation. So I modify my technique depending upon the IOL which I am using. Now I clear off the visco. Most of the visco is cleared by this time in hydroimplantation, and I form the anterior chamber by doing the stromal hydration of the main port and both the side ports and check for any leaks. So as you can see, modified stop and chop technique is a very efficient method for doing phacoemulsification. Thank you for your time.